Hello and welcome to Basic Spanish for OT, PT, and SLP clinicians. My name is Juanita and I will be your host. I am an occupational therapy assistant as well as the author of this book, Basic Spanish for OT, PT, and SLP clinicians in the acute hospital setting. This book, as well as the ebook, can be purchased on Amazon.com. I will leave a link on the channel. If you have your copy of the book, I would invite you to turn to page 96, where we will continue with basic questions and commands. If you don't have a copy, let me use this time to invite you or to encourage you to get a copy of the book, as it will make it much easier for you to follow along. With that being said, vamos a empezar. On page 96, the first question, or actually it's the first statement, is something that we as therapy clinicians use all the time. We're explaining what we do. That is one of the first things that we have to do when we walk into the patient's room, besides telling the patient who we are. So this first statement is, I am here to help you get stronger. So when you walk into your patient's room, you told them who you are. Now they want to know why. Why are you here? So to say that in Spanish, it's estoy aquí para ayudarte a ser más fuerte. Estoy aquí para ayudarte a ser más fuerte. I'll read that one more time. Estoy aquí para ayudarte a ser más fuerte. And that is to say, I am here to help you get more stronger, or to get stronger. The next one, I am here to help you become more independent, which is another thing that we're, as therapy clinicians, that's what we're working on. A patient becoming independent and doing more for themselves and decreasing the burden of care for their family. So that one would be, estoy aquí para ayudarte a ser más independiente. Estoy aquí para ayudarte a ser más independiente. So that's a lot of syllables on the last one. The last time, estoy aquí para ayudarte a ser más independiente. Okay? The next one is used by our speech language pathologists when they're checking the swallow function of their patient. So, I am here to check your swallow function. Estoy aquí para comprobar su función de tragar. I'll say that again. Estoy aquí para comprobar su función de tragar. One last time. Estoy aquí para comprobar su función de tragar. The next one, I am here to help you. Estoy aquí para ayudarte. Estoy aquí para ayudarte. Estoy aquí para ayudarte. The next one, I am sorry I cannot give you water. Many times our patients are in the hospital and they have restrictions. Our speech language pathologists know this, as well as all of our clinicians. Many times our patients are not allowed to drink. They cannot maybe not have food, or maybe they're NPO for whatever reason, or if they can't have thin liquids. So they have to have their water thickened. So in that case, you can say, I cannot give you water. You can say, lo siento, no puedo darte agua. Lo siento, no puedo darte agua. Lo siento, no puedo darte agua. So that's, I'm sorry, I cannot give you water. The next one, I speak a little Spanish. Hablo un poco de español. Hablo un poco de español. Hablo un poco de español. And the last one on page 96, I want you to copy what I'm doing. So let's say you're doing an exercise and you want your patient to follow what you're doing. Quiero que copies lo que estoy haciendo. Quiero que copies lo que estoy haciendo. Quiero que copies lo que estoy haciendo. So that's it. And we are at the 6-minute mark, and I'm trying to keep the videos under 10 minutes, but we do have time. Do you know what I'm saying? So I will repeat one of the sentences I just said, or I will repeat the sentences, and you try to think if you understand or you remember what I'm saying. So let's start. Estoy aquí para ayudarte a ser más fuerte. Quiero que copies lo que estoy haciendo. Estoy aquí para ayudarte a ser más independiente. Hablo un poco de español. Estoy aquí para comprobar su función de tragar. Lo siento, no puedo darte agua. Estoy aquí para ayudarte. So, we've come to the end of page 96. Remember, I'm keeping it under 10 minutes so you have an opportunity to listen and repeat. Listen and repeat. I'm not sure, I don't think I said this at the beginning, but if you like these series of videos and would like to know when they're being uploaded, then I encourage you to hit the subscribe button so you will get a notification, as well as hit the like button if you like these series of videos. With that being said, gracias por venir. I'll see you in the next video. Adios.